Welcome back, everyone. I hope you enjoyed your lunch. It is 1 o'clock, so we are going to get started because we have a full schedule for the next 4 hours, 3 hours, 3.5 hours. So I have been told that we have some extra resource manuals, so I thought that I could give some away by giving a short quiz. So I'm going to ask a question, and the first person who gets to the mic and answers the correct answer, I'm going to give you up to 3 resource manuals. Your choice. Okay, ready? This is going to be easy. And I'm pulling these out of my head, so. Can someone define the date of event for a LabID event? Go ahead, together is fine. Oh, the first quiz. How do we turn on the mic?
The day the specimen was collected.
Twins. You're going to get these wonderful resource manuals. So come and see me at the end of my session, and I'm going to give you your resource manuals. I'll give them to you when we're done. I promise I'll hold them for you. Okay, so we're going to switch gears a little bit. We are still on the LabID event module, but we are switching to multi-drug resistant organisms now. So as I said before lunch, I think we're going to finish this session in about 45 or 50 minutes, and then we'll move right into UTIs because that is the most time-consuming session that we have today. So for all of you streamers, if you are going to take a break, be sure to come back at 1:45 for urinary tract infections. So why do we monitor multi-drug resistant organisms in long-term care facilities? Why is this important? I know Janita touched on a lot of this earlier, so some of this is going to be a repetition, but residents in long-term care facilities are at risk of carrying and acquiring multi-drug resistant organisms, such as MRSA and VRE, which are the 2 common ones that we hear about. Infections from multi-drug resistant organisms can be more severe, harder to treat, and are associated with increased risk of hospitalization, debility, and death, especially among our older adults. We know from studies that focused monitoring of multi-drug resistant organisms helps to evaluate trends and changes in the occurrence of these pathogens and related infections over time. And then also tracking these infections will help inform your infection prevention programs in your facilities. I think this is the 3rd time that you've seen this screenshot today, but just to remind you that all of our protocols are available on our webpage. For the LabID event reporting specifically, you will go to the MDRO/C. diff surveillance section, and if you click in the box, it will open that page for you where you will have access to all of the protocols, forms, supporting materials, etc. As I mentioned earlier, within the LabID event module, there are several options for reporting. Users have the option to report C. difficile, which we talked about earlier, as well as the common multi-drug resistant organisms. Within the multi-drug resistant module, facilities can choose to monitor one or more of the following. And I'm going to define these later, but I'm going to try to pronounce all of these words now. So MRSA, Staphylococcus aureus methicillin resistant, or MESA, which is our methicillin susceptible Staphylococcus aureus, Enterococcus or vancomycin resistant Enterococcus species, or VRE, cephalosporin resistant Klebsiella species, carbapenem resistant Enterobacteriaceae, or CRE, When a facility chooses to follow CRE, the facility must include all 3 of the CREs that I've listed here. So that includes Klebsiella species, E. coli, and Enterobacter. And then users also have the option to follow and report multi-drug resistant Acinetobacter species. Here's that monthly reporting plan again. The monthly reporting plan must be completed. So the NHSN knows each month which modules you plan to follow, and that includes organism-specific. Surveillance for MDROs must occur in all locations, resident care locations within the facility, referred to as FACWIDEIN or FACWIDEIN, and also for all specimen sources. So for C. difficile, we looked at stool specimens only. When a facility chooses to monitor MDROs, they are agreeing, for NHSN, they are agreeing to monitor MDROs or the selected MDROs in all specimen sources in the facility. There is not an option to report specific specimens for the MDROs for long-term care facilities. And then again, for each participating month, the facility must report numerators, which are your MDRO LabID events, and denominators, which include the number of resident admissions and number of resident days for the entire facility. Here is an example of the monthly reporting plan. I want to show you here. So we're back in this LabID event module, just like we did for C. difficile. You will notice your first column is FACWIDEIN, which is your default location, meaning you're reporting the MDRO for the entire facility. And then the next column, you're going to select your specific organism. And this list will give you a drop-down of all of the available organisms in the LabID event module. And then the next column will auto-default to check the box for all specimens, meaning you're going to report for this specific organism for all specimen sources. If you're ambitious and you want to report all of the MDROs that are available, then you will have to add additional rows to your reporting plan. And to do that, you simply just click Add Row, and it will pre-populate an extra row for you. And then you would add your additional organism. If you are following, I would say, more than one organism in the LabID event module, it would be really efficient for you to just copy from previous months each time you do your monthly reporting plan. So instead of selecting each individual row, you could just copy from previous month, and it would pre-populate your plan from last month for you. And that's just a little trick that makes your life much easier. Here is the numerator data form. This is the same form that you would use for C. difficile LabID event reporting. One form per event. And again, we do have table of instructions available for you. Next, we're going to get to the key terms and definitions for the multi-drug resistant organisms within the NHSN. MRSA, which is our methicillin-resistant Staphylococcus aureus, is a lab test testing resistant to oxacillin, methicillin, or cefoxitin by standard susceptibility testing methods, or by a positive result from an FDA-approved test for direct MRSA detection from that specimen source. If you are not a person with a lab background, this is very confusing, I understand. You have MESA, which is your methicillin-susceptible Staph aureus, is testing intermediate or susceptible to oxacillin, methicillin, and cefoxitin by standard susceptibility testing methods. A positive result from an FDA-approved test for direct MESA detection from that specimen source, or a negative result from an FDA-approved test for direct MRSA detection from a specimen source. Next, VRE is defined as any Enterococcus species that is resistant to vancomycin by standard susceptibility testing methods, or by a positive result from an FDA-approved test for VRE detection in that specimen source. So these are all of the gram-positive organisms that are available in the MDRO module. Next, we're going to go to the gram-negative organisms. You have cephalosporin-resistant Klebsiella, which is defined as Klebsiella species testing non-susceptible, which means resistant or intermediate, to cephalosporin antibiotics, like cefepime or ceftriaxone. Then you have CRE, which remember, CRE is inclusive of E. coli, Klebsiella species, and Enterobacter species. Testing resistant to imipenem, meropenem, doropenem, or ertapenem by standard susceptibility testing methods. It's a lot of words to read. Okay, and then your MDRO Acinetobacter. So this is defined as any Acinetobacter species testing non-susceptible, so in other words, resistant or intermediate to at least one agent and at least 3 antimicrobial classes. So you have 6 antimicrobial classes here, so here's your classes. So you must test resistant to at least 3 out of this column, okay? And then one agent out of that column. An MDRO positive isolate is defined as any specimen obtained for clinical decision-making purposes that is positive for a multi-drug resistant organism. The definition within NHSN for an MDRO positive isolate does exclude any test related to active surveillance testing. So your nasal screens, your rectal screens, those are all excluded from reporting in NHSN for the LabID event module. An MDRO LabID event is defined as an MDRO positive isolate tested on any specimen source. Remember, we're looking at all specimen sources. And the resident has no positive prior for the same organism from any specimen source collected in the same calendar month. So this is a little bit different from the C. difficile, where we're looking at 2 weeks for C. difficile. But for MDRO non-bloods, we're looking at 1 per month. Okay, so the exception is when there's a unique blood source. And I'm going to define that shortly. Let's look at an example. On January 2nd, Mr. Cleveland Brown had a positive urine culture. Since this was the first positive MRSA specimen collected for him during the calendar month, the specimen is considered an MDRO positive isolate and should be submitted to the NHSN as an MRSA LabID event. The following week, he had a MRSA culture from an infected decubitus ulcer. The MRSA wound culture was considered a duplicate MDRO positive isolate since it was the second non-blood MRSA isolate collected for Mr. Cleveland Brown during the same calendar month, and therefore it was not reported to NHSN as a LabID event. It was considered a duplicate. Let's talk a little bit about the unique blood source that I mentioned. A unique blood source is an MDRO isolate identified in a resident with no prior positive culture for that same MDRO in the past 2 weeks or less than 15 days, even across calendar months and admissions. Just to keep in mind, a unique blood source isolate must be reported even if the resident had the same MDRO previously isolated in a blood specimen earlier during the same calendar month. We're going to talk about this in detail, don't worry. Here's some tips that are going to help us get through the rest of this session. All first MDRO isolates per resident per month are reported as a LabID event, regardless of the specimen source. So the very first specimen that a resident has that's MDRO is considered a LabID event. If a blood isolate is your first positive MDRO specimen for the month, it also is considered the first LabID event, regardless when the resident had another positive blood, okay? So it should be reported as a LabID event. If a blood specimen is entered as the first specimen of the month, then no other non-blood specimens can be entered for that month, because remember, it's 1 MDRO per month unless it's a unique blood source. So since our blood source came first, no other same MDRO specimens can be entered for that resident for that month. The remainder for the month are considered duplicate. The exception is if the resident has another positive blood culture with the same organism. In that case, you're going to follow that 2-week rule. It goes back to the same rule that you follow with the C. difficile LabID event. So another positive MRSA blood that is collected greater than 2 weeks since the most recent positive MRSA blood is considered a unique blood source and should be reported. Let's look at an example. On December 27th, Mr. Clean had a positive MRSA blood culture that was entered into the NHSN as a MRSA LabID event. Then, on January 2nd, he had another positive MRSA blood culture that was also entered into the NHSN because it was the first positive MRSA isolate for that new calendar month. He then had a wound that tested positive for MRSA on January 20th. This specimen was not entered into NHSN since it represented a duplicate MDRO laboratory isolate for January. Again, on January 27th, Mr. Clean had another positive MRSA blood culture. Since the isolate represented a unique blood source, meaning it had been more than 14 days since the last positive MRSA blood specimen, the MRSA blood specimen was submitted to the NHSN as a MRSA LabID event. If all of this is still a little blurry to you, you have Figure 2. Figure 2 is great. This is another one of these pictures that I print out and I keep at my desk, and I recommend that you all do the same. It's easy to follow, and it helps you to understand. Do you guys want me to go over this, or are you feeling good? Who wants me to go over it? Okay, I have some hands up. Okay, so let's go through this. So our first question is that the resident, our first box is the resident has a positive MDRO isolate collected from any specimen source. Yes, we answer yes to that. Is it the first in the calendar month? If it's yes, then it automatically gets reported, no matter what. Yes, it's reported. But if it is not the first specimen in the calendar month, no, it's a duplicate MDRO unless, go over here, the source equals blood. If the source equals blood, then no, it is. If the source does not equal blood, so no for not blood, then it is not an MDRO LabID event, it is a duplicate. However, if the source blood equals yes, then you ask, has the resident had a prior positive result with that same MDRO organism from the blood in less than 15 days, including across calendar months? If the answer is yes, then it is a duplicate and it is not reported to NHSN as a LabID event. If the answer is no, then it is considered a unique blood source and it's reported as a LabID event. Let's make sure we all understand. So meet Mr. Smith. Assume that this line list is for Mr. Smith and all of the specimens that we have for him are shown on our line list here. So his current admission date is 2/1/17 for all of these specimens. The first one, the specimen collection date is 2/2. The specimen source is a urine and it is positive for MRSA. Do we report this as a LabID event? Yes. It is our first positive MRSA during that calendar month. He had another specimen collected on 2/17, and this time it was a wound specimen, and it was positive for MRSA. Do we report this? Very good. No, this is a non-blood source, and he already had a positive non-blood for the month. Again, on 2/21, he had a specimen source of a blood that was positive for MRSA. Do we report this? Yes, because this is considered a unique blood source since he has not had a prior MRSA positive in the blood in the previous 2 weeks. Then again, on 2/26, he had another MRSA positive blood culture. Do we report this? Correct. It's been less than 15 days since the previous MRSA blood specimen, so this is considered a duplicate and not reported. On 2/28, he had a nasal screen that was positive for MRSA. Do we report this? Aside from it being another positive MRSA, screening results are never included in your count or reported period. So even if this nasal screen had been the first positive that he had for the month, you still would not report this since it's a screening culture, okay? On 3/1, we're in a new calendar month now, Mr. Smith had a positive MRSA blood culture. Do we report this? We do report it. So even though it's been less than 2 weeks since his last positive MRSA blood, right? This is a new calendar month. So that's the exception. When it's the first MRSA positive in the calendar month, you report it regardless of the specimen source. And then on 3/11, he had a urine that was positive for MRSA. Do we report this one? No, this is considered a non-blood source, and he's already had a MRSA positive for the month. So in reality, for the month of March, You would not report any more MRSA positives unless he had another blood that occurred 2 weeks after the 3-1 blood. Okay, let's talk about submitting an MDRO LabID event into the NHSN. The steps are very similar to what we've gone through with our C. difficile LabID event. You go to Event and you click Add. The first part is your resident information. So remember, everything with a red asterisk must be completed. And then you come to your resident type, and you must select between short stay and long stay. Short stay is defined as the resident has been in your facility for 100 days or less from the first date of admission. Long stay is defined as the resident has been in your facility for more than 100 calendar days from the date of first admission. And then you come to the date of first admission to the facility is the date. Remember, this date is the date the resident first entered your facility, and this date does not change unless the facility or the resident leaves your facility for greater than 30 consecutive calendar days. The date of current admission to the facility is defined as the most recent date the resident entered the facility. If the resident enters the facility for the first time and has not left for greater than 2 calendar days, then that date of current admission will be the same as the date of the first admission. If the resident leaves your facility for any reason and is out of your facility for more than 2 calendar days, then the date of current admission should be updated to the date the resident returns to your facility. Okay, then once we've entered all of our resident information, we scroll down to the event information. Again, your event type is going to be LabID event. This is the option for MDRO and CDI. The date of specimen collection is your date of event. The next box is going to ask you to identify the specific organism type. So let's make it easy and choose MRSA. We're going to select MRSA as our specific organism type. And then the next box is going to ask you for specimen, body site, or system. And this is based on where the specimen was collected. So let's pretend that we have a positive MRSA blood. So we will select, in this case, cardiovascular, circulatory lymphatics here for our positive blood. And then the next question is the specimen source. What specimen source did it come from? And you can see you have a long list here, so we're going to select blood specimen. The table of instructions for completing an MDRO LabID event does define each of these specimen sources. So in here it's abbreviated, but if you look at those table of instructions, it gives you a more detailed definition for each of the body site systems and the specimen sources. The next box is the resident care location, and you want to select the location of that resident at the time the specimen was collected. Remember, these are the locations that you set up during your initial setup of the NHSN, so they're defined by your facility. And then the next box is the primary resident service type at the time the specimen was collected, and remember, these are the NHSN defined locations. And these primary resident service types are the same, and no matter what event you are reporting, they stay the same. And so do your resident care locations. You'll receive another question. Has a resident been transferred from an acute care facility in the past 4 weeks? So this is the same as C. diff reporting. If you select yes, that the resident was directly admitted to your facility from an acute care facility in the past 4 weeks, then additional questions will populate with the date of last transfer from the acute care facility to your facility, and if the resident was on antibiotic therapy for this specific organism type at the time of transfer to your facility. I know that we had some questions about this last question in the C. difficile session, and I just want to point out that The facility should have access when a resident is transferred from an acute care facility. That resident should have a medication list that is available upon transfer, and that is where you will get this information as well as the information for the C. difficile. And then here's that documented evidence of previous infection or colonization. Ignore this. Remember, you are unable to edit this field, and this is an internal analysis tool that's auto-populated by NHSN, and it's really looking at, has this resident ever had a positive like MDRO reported in NHSN? The custom fields that we talked about, so these are optional, and they should be set up beforehand for custom fields, and you can have up to 50 custom fields. This will be useful for MDROs as well as C. difficile, and then the comments, remember, are free text that you can type in information that will be useful to you and your facility. Once you've entered all of your event information, click Save, and you will receive an event number to let you know that the event was created successfully. Okay, we're going to denominator reporting next. There are 2 form options for reporting denominators for MDROs. These are the exact same forms that I talked about for C. difficile. So these forms can be used to collect both CDI as well as MDRO LabID events. And just keeping in mind that only aggregate data, only your totals for each month are entered into the NHSN. But some of our facilities, especially like this denominator for long-term care facility form, because it allows the facilities to document daily counts. So the daily counts for the number of residents and number of admissions and so forth. The denominator data is entered into the summary data page, which again, on the left side of your navigation screen, you would click summary data and then add. Select the month and year for which you were reporting your denominator data. Like I pointed out in the C. difficile session, this page will match the selections that you've made in your monthly reporting plan. So for this page, our monthly reporting plan, we did not choose to select prevention process measures or UTI. So the only selection we have is the MDRO and CDI LabID event reporting. Everything in the red asterisk, remember, we have to complete. And you'll notice that the variables are different for MDROs. They don't ask some of the same questions that are asked for the C. difficile reporting. So for here, you're going to enter your resident admissions, your resident days, and then the first column here, LabID events. The boxes are checked for each organism, which is included in plan for us. So all of these organisms are in our monthly reporting plan. We selected MRSA and CRE for our monthly reporting plan for the month of January. If you look in the next column, report no events, all of these boxes have red asterisks. So that means our nursing home is doing a great job, and we did not report any MRSA, nor did we have any CREs for the month. So you would simply put a check mark in these boxes just to acknowledge that the application is correct, and then you click Save. It's just another screenshot here. Well, I got a little ahead of myself again, but you guys get it. Okay, here is a complete monthly summary. For January 2017, you can see we completed everything. And I did a different screenshot on this because I did want to just show you what it would look like if you did report an event. So the report no events for MRSA, there's no red asterisk. And remember, and that's grayed out. So what this means is that we did report a MRSA event for this month, but then the CREs we did not. Once you save your monthly reporting plan, you will get a pop-up message that says your summary data have been created successfully. Next, I want to talk a little bit about the LabID event categorizations for MDROs. This is similar to the categorizations for C. difficile, and Elizabeth is going to talk more in detail with you all about what these mean and some examples in the analysis section today. But community onset LabID event, or a CO, is defined as the specimen is collected 3 or less calendar days after admission to the facility. So the specimen is collected on day 1, day 2, or day 3 of admission to your facility. Then the long-term care facility onset, or LO, is when the date of the specimen collection occurs more than 3 days after the current admission to the facility, so on day 4 or after. Then the long-term care facility onset LabID events are further classified or subclassified as the acute care transfer long-term care facility onset, or ACTLO. The LTCF onset LabID event with a specimen collected equal to or less than 4 weeks following the last date of transfer from an acute care facility. So remember that question that asked, has the resident transferred from acute care facility? That is what is used to calculate this measure here. Same example that we talked about earlier. So if the resident is admitted on March 1st, a specimen collected on March 1st, March 2nd, or March 3rd will all be categorized by NHSN as community onset. A specimen collected March 4th or later will be categorized by NHSN as long-term care facility onset. Remembering that all community onset and long-term care facility onsets that are non-duplicate should be entered into the NHSN application, even if that specimen is collected on day 1 of admission to your facility. I want to go over some key points that we talked about. MDRO LabID event reporting is only for collecting and tracking isolates from positive cultures that are taken for clinical purposes, which means active surveillance testing results are excluded. When performing LabID event reporting for MDROs, the facility must report the selected MDROs from all specimen sources and from all resident care locations in the facility. And then NHSN recommends facilities keeping that internal line listing of all positive isolates because the calculations in NHSN, the business rules are the same when it comes to looking at your categorizations based on the most recent LabID event, and the NHSN application does not know about the other positive lab tests. So it's important that you know about those so that you're not entering information incorrectly and getting penalized for that. All first MDRO isolates per resident per month are reported as a LabID event regardless of the specimen source. If the first MDRO isolate for the resident and calendar month is a blood isolate, the specimen should be reported as a LabID event even if the previous MDRO blood isolate was reported in the previous 2 weeks. If the blood specimen is entered as your first specimen of the month, then no other non-blood specimens can be entered for the remainder of that calendar month. However, if another positive blood culture does occur, it can be entered only if it was collected greater than 14 days after the most recent positive blood culture for that same organism. As a general rule, at a maximum, there should be no more than 2 blood isolates, which is rare, we don't see that very much, and 1 other specimen source isolate per MDRO per calendar month. And then the LabID event rules apply to specimens collected while the resident is receiving care from the long-term care facility, and this includes specimens that are collected from the emergency department or outpatient setting during the resident's current admission, which means the specimen is collected on the day that resident transfers to the outpatient location or the following day, and that resident returns back to your facility within those 2 calendar days. Any laboratory results obtained from the resident prior to admission to the long-term care facility or during an admission anytime to an inpatient facility are excluded for LabID event reporting. And then we talked about this, if the specimen is collected while the resident is receiving care in that emergency department or outpatient setting, the resident care location and primary resident service type should reflect the resident's primary location in the long-term care facility prior to going out to that outpatient visit. Okay. Are we ready to try our clickers again? Okay, fingers crossed. Oh, it shows polling open. I think we can do this. On April 1st, Mr. Einstein, a resident in your nursing home, had a wound culture that tested positive for MRSA. Since it was the first MRSA specimen for Mr. Einstein for the month of April, it was submitted to NHSN as an MDRO MRSA LabID event. 2 weeks later, on April 16th, Mr. Einstein had a urine culture that tested positive for MRSA. Should this result be submitted to NHSN as a MRSA LabID event? Click 1 for yes, this is a new specimen, or 2 for no, only the first non-blood MRSA specimen should be submitted for the calendar month, or 3 if you're not sure. Okay. Very good. The correct answer is no. Only the first non-blood MRSA specimen should be submitted for the calendar month. On March 5th, Mr. Herbert had a positive urine culture with MRSA. Since this was the first MRSA specimen for Mr. Herbert for the month of March, it was submitted to NHSN as an MDRO MRSA LabID event. On March 10th, he had a positive MRSA blood culture. Should this result be submitted to NHSN as an MDRO LabID event? 1, yes, since the specimen is a blood source. 2, no. Only the first MRSA specimen should be submitted for the calendar month. Or 3, I'm not sure. Okay, good job. Correct answer is yes, since this is the this blood specimen represents a unique specimen source. Good job. Okay, we're going to continue with Mr. Herbert. So on March 5th, he had a positive urine culture with MRSA. Since this was the first positive MRSA specimen for Mr. Herbert for the month of March, it was submitted to NHSN as an MDRO MRSA LabID event. On March 10th, he had a positive MRSA blood culture, which was also submitted as the MDRO MRSA LabID event, since it represented a unique blood source. Another blood culture was collected more than 2 weeks later on March 28th. Should this blood culture be submitted to NHSN as a MRSA LabID event? 1, yes, since the previous blood specimen was collected more than 14 days ago. 2, no, only the first MRSA blood should be submitted for the calendar month. Or 3, I'm not sure. Good job. Yes, since the previous blood specimen was collected more than 14 days ago. Case scenario 3. On June 30th, Dr. Seuss had a positive MRSA blood culture. Less than a week later, on July 5th, he had another MRSA positive blood culture. He had no other MRSA positive cultures during the month of July. Should the blood culture collected on July 5th be submitted to NHSN as a MRSA LabID event? Yes. Number 1, yes, since the blood specimen represents the first MRSA positive specimen for the new calendar month. 2, no, the previous MRSA positive blood test was collected less than 2 weeks ago. Or 3, I'm not sure. Okay, 72% of you got this correct. So yes, since the blood specimen represents the first MRSA positive for the new calendar month. Case scenario 4. Mr. Griffin is a resident in your skilled nursing facility. On March 1st, he has a fever and a red draining decubitus ulcer. The on-call physician decides to send Mr. Griffin to the local emergency room for evaluation. After evaluation, Mr. Griffin was admitted to the hospital where blood and wound cultures tested positive for MRSA. Since he was a resident in your skilled nursing facility, should you submit the MRSA positive blood and wound culture to NHSN as a LabID event? Yes. Number 1, yes. The nursing home must report all positive specimens for its resident. Number 2, no. Specimens collected during an inpatient admission in another facility are not submitted as LabID events for the nursing home. Or 3, it depends on the date the specimens were collected. This one's a little more challenging. Good job. 73% of you are correct. No, specimens collected during an inpatient admission at another facility are not submitted as LabID events for your nursing home. Good job. Okay. All right, we finished MDRO in record time. Do you guys need to stand up and take a quick stretch before we move into urinary tract infections? I know this is a lot of material.
Can I ask you a question?
Yes, we will
Hi.
take questions.
Sorry. Rhonda Blevins, Parkview Hospital in Fort Wayne, Indiana.
Okay, can we keep it down, please? We have a question. Okay, try again.
The reporting for vancomycin resistance with the Enterococcus species, are you reporting, or are we reporting Gallinarum and Cassila flavus?
If it's not specified in the protocol, we are not reporting those right now. Is that something that you're seeing?
No. Those are intrinsically resistant. So I just didn't know. It says all VRE.
So if it's all species, then yes, you would report that. I don't have it in front of me, but yes, if it's all, then you would report that.
Okay, because normally those are not important for infection control.
Okay, that's good to know. Thank you.
Hi, Janet from New England again.
Hi.
My question is about the inclusion of MSSA. I'm looking at slide 84. It's included on the list of organisms, but then on slide 96, it's not included on the reporting page. My question in general is, why is MSSA included as a multi-drug resistant organism? And again, it's on that list, but then not on the reporting.
Right, so I would have to look at that. I don't have that in front of me, but that is included, and actually that has been in our protocols for a long time because some facilities want to look at the percentage of their Staphylococcus aureus that are resistant versus the percentage that are not. So that's the historical that I know. I honestly don't know that we have any facilities that are just reporting MSSA. The discrepancy that you point out, I'll have to get with you after the training and take a look at those pages since I don't have them in front of me.
And I'm asking because the inclusion of MSSA on a list of multi-drug resistant organisms is very confusing to long-term care facilities. And then it leads into other problems for them about what type of precautions and just kind of understanding that difference.
Okay, that's a great point. Definitely, I would like to have a conversation with you afterwards so we can talk about that. Thank you. Do we have more questions? The good news is that we have two of our infectious disease physicians here today listening to your comments, so we appreciate the feedback that you're giving us because they're able to hear this, and we're constantly improving our protocols so that they are user-friendly but also relevant to what you're seeing out in the field. So we appreciate all this feedback, and if you're afraid to go up to the mic, which I know many of you are, I've already heard, then send us an email. If you're seeing something in the field that's a discrepancy between what we are asking you to report in our protocols, please let us know so that we can review that. We have a great team of experts that's what they live for. So, right? Okay.